Hello everyone, I am Animal CK, first MSc Biology, St. Mary's College, Thrissur. Today we are discussing about primary immunodeficiency diseases. Immunity and malnutrition. Immunity is a condition of being able to resist a particular disease, especially through preventing the development of pathogenic microorganism or by counteracting the effect of its products. Otherwise, it is the capability of the body to resist harmful microorganism or viruses or any other foreign particle from entering it. Malnutrition refers to deficiencies, excess or imbalance in person's intake of energy or nutrient. It can be a result of starvation, in which a person has an inadequate intake of calories, or it may be related to deficiency of one particular nutrient. Malnutrition can also occur because a person cannot properly digest or absorb the nutrients from the food they consume. Primary immune deficiency may affect either adaptive or innate immune function. Most are genetically determined. Less common, usually diseases of infancy and childhood. First one is Burton disease. A B-cell defect called X-linked agammaglobulinemia (XLA) or Burton's hypogammaglobulinemia is characterized by extremely low IgG levels and by the absence of other immunoglobulin classes. It is a rare genetic disorder discovered in 1952 that affects the body's ability to fight infection. It is X-linked. It is much common in males. Individuals with XLA have no peripheral B cells and suffer from recurrent bacterial infections beginning at about 9 months of age. Discovered by Colonel O'Gaden Burton in 1952. There is a defect in a transduction molecule called Burton tyrosine kinase (BTK) gene that leads to a severe block in B cell development and a reduced immunoglobulin production in the serum. Then antibiotics are another common supplementary treatment for this disease. Early diagnosis and treatment would improve the survival. Gene therapy of XLA could be considered as a paradigm for future. Most common treatment for this is an intravenous infusion of immunoglobulin (IVIG) every week for life. IVIG is a human product extracted and pooled from thousands of blood donations. It will increase the patient's lifespan and quality of life by boosting the immune system. Next one is DiGeorge syndrome. DiGeorge syndrome or congenital thymic aplasia in its most severe form is the complete absence of a thymus. This development defect, which is associated with the deletion in the embryo of a region on chromosome, causes immunodeficiency along with characteristic facial abnormalities, hyperparathyroidism, congenital heart disease. Facial features of children with DiGeorge syndrome: cleft palate, anti-monoglot eyes, short philtrum with fish mouth appearance, micrognathia, lowest ears, heavy eyelids. This disease is sometimes called third and fourth pharyngeal pouch syndrome. Although B cells are present in normal numbers, affected individuals do not produce antibody in response to immunization with specific antigens. As name implies, thymic hypoplasia is a defect in which a vestigial thymus is unable to serve its function in T cell development. In some patients, B cells are normal, where in others, a B cell deficiency is secondary to the T cell defect. Next one is severe combined immunodeficiency (SCID). In SCID, neither the T cell or the B cell work properly. Babies with SCID can't produce IgG, so once the IgG from the mother has gone, they easily get the types of infection that antibodies are good at preventing. SCID is often called bubble boy disease. It became widely known during the 1970s and 80s, when the world learned of David Vetter, a boy with X-linked SCID who lived for 12 years in a plastic germ-free bubble. Features: absent tonsils, small or absent lymph node, decreased number of T cell, no IgG usually present. Children with SCID may develop infections caused by organisms or vaccines. The most common treatment for SCID is bone marrow transplantation. Another treatment is gene therapy. This disease is characterized caused by a very low number of circulating lymphocytes. The thymus does not develop, and few circulating T cells in SCID patients do not respond to stimulation by nitrogens, indicating that they cannot proliferate in response to antigens. Reference. Thank you.